Hi, my name is Teresa Rincon, and I'm a senior telehealth consultant with Blue Cirrus Consulting. Today, I'd like to talk to you about video etiquette. There are important reasons why we want to think about video etiquette even before we start a visit with our patients. Here's 10 tips to think about as you prepare for a video visit with your patient. Tip number 1, ensure that you have a professional background. As you can see behind me, I've staged various elements. I have a diploma and some awards and other types of documents that lend themselves to my credibility as a clinician. These are the types of things you may want to have in your background. But whatever you choose to have in your background, ensure that it is professional and not distracting to the visit. Number 2, appropriate lighting. Appropriate lighting is very important on both sides of the camera. You need to be able to see the patient clearly, and the patient needs to be able to see you clearly. Ensuring that there is appropriate lighting in the video visit will enhance the experience for both the patient and the provider. Having the light in front of you versus behind you is one good thing to think about as you set your room up. Practice in a video visit before you start the video visit with your patients. Number 3, privacy. We need to ensure that the environment in which we're conducting the video visit is private. If there's a door, we should close the door. If there's a window where someone could see what we are doing, we should put a shade or some type of other covering on that window. We also may want to put a covering on the window in different times of day due to lighting changes. It's also important to ensure that the patient's environment is private. Asking the patient, do you feel comfortable continuing with this visit? Are you in a place that's private where you can talk freely? If there are other people in the room where the patient is, ask the patient to introduce those folks. And ask the patient if they're comfortable continuing with the video visit with these other people in the room. Number 4, introduce yourself and ensure that you have some form of identification. You could wear your name badge, as I have on here. You may also want to put your name and your credentials at the bottom of the screen. Most telehealth platforms allow you to type in your name and your credentials. Number 5, look at the camera. When we look away from the camera, it looks like we're not paying attention to the patient. We're not attending to them. So it's very important that we look at the camera as we talk to the patient. Don't wear busy prints. Solid colors are always better. That's tip number 6. We want to make sure that whatever we're wearing, it promotes us professionally, and it lends itself to our credibility. Busy prints and jewelry that is loud or distracting can cause patients to not attend to what you're talking about, why you're here for the visit. Number 7, don't chew gum, eat, or drink. Number 8, explain what you are doing. Again, as I spoke earlier about looking at the camera, if you need to look away at a different screen, explain to the patient why you're looking away. When the patient's in the office with you, they can see that you're logging into the computer and you're looking up information. So when you need to look away during the video visit, explain to the patient, I'm typing in your information now so that I can look up your medical record. I'm going to be checking your labs or your last x-ray. Whatever it is, the information you're seeking, explain to the patient what you're doing, and this will help put the patient at ease. Number 9, set devices to do not disturb. You can do this on both your laptop, computers, iPads, iPhones, whatever devices are going to be in the room with you while you're conducting the visit. Make sure they're set to silent or turned off so that they don't interrupt the video visit. Number 10, it's okay to stop the video visit at any time. If you as the provider feel uncomfortable continuing with your assessment over the video visit for any reason, you may want to stop the visit and instruct the patient to either reschedule for a different time or to come in person. In the same token, the patient needs to understand that at any point, if they're uncomfortable continuing with this visit over video, they can stop the visit and they can reschedule at a different time or they can come in person. I hope these tips were helpful. Thank you so much for your time and attention.